Thank you, Acting Speaker, and I rise to speak in support of the Drugs, Poisons and Controlled Substances Amendment Medication Administration in Residential Aged Care Bill 2025. And firstly, I was out at an aged care facility only a couple of weeks ago to celebrate Aged Care Worker Day, and it was fantastic to be out there. And I just want to pick up on one thing that the member for Hawthorn just raised about personal care attendants. I think this is not about either replacing them or whatever. This is actually about protecting personal care attendants in the treatment and support that they give to aged care residents and patients. I'm sure that some personal care attendants have been put in positions where they haven't wanted to administer some of the drugs, but have probably been forced to do that, and not knowing the ramifications of some of the drugs if things went wrong, or if they were, happened to overdose the person, I think it does protect patient care attendants, and they do a fantastic job, and it was great to be out there a couple of weeks ago celebrating Aged Care Worker Day. Of course, this bill is about one of the most fundamental responsibilities in regard to that we have here in Parliament, ensuring that our older Victorians who built this state, our parents, our grandparents, our neighbours, and of course our loved ones, and there's been many, many stories from all the contributions made on this bill about their experiences in regard to aged care facilities. And of course, those residents need to receive the dignity that they deserve, the safety, and of course the professional care that they deserve in their later years. And of course, what must come first is the welfare of those people. And that's what this bill is all about, and that is making sure that those residents are protected. This bill enshrines a clear and important obligation that in Victorian residential aged care facilities, only registered nurses and enrolled nurses or other registered health practitioners can administer certain classes of medications. And those sort of medications might be Schedule 9 poisons, Schedule 8 controlled drugs, Schedule 4 prescription medications, and of course drugs of dependence. And of course, as I said, we've all had aged care experiences, and some will be because of parents or family members that are in aged care facilities. In my situation, it was because when I was a paramedic responding to aged care facilities for medical episodes, and some of that would have been due to administration of medication where the resident has had some negative response to it, whether that been because of an overdose or the type of drug that they were given. It might have led to a fall of that elderly patient where they sustained a fracture. So my experiences in aged care facilities was as a responding paramedic. I've not had relatives in any aged care facilities. My parents didn't live long enough to get to aged care, unfortunately. So I haven't had that experience of having parents in an aged care facility. Of course, this reform is not just a simple technical adjustment. It's about protecting the residents, as we've said, from medication errors, upholding professional standards of nursing, and responding to the long-standing calls of the aged care workforce, the unions, of course, and of course the families. And it's all about keeping faith with the commitments this government made, and it is about delivering on those commitments. Of course, the importance of medication safety in aged care has been recognised for years now, and of course the 2021 Royal Commission into Aged Care Quality and Safety was unequivocal in its findings, and medication management was one of the weakest links in that chain of care, but yet one of the most important things to maintain a patient's health and welfare. Of course, the Royal Commission documented many cases where residents were given tablets without any oversight whatsoever, and where medicines were administered incorrectly, and where errors went uncorrected. And again, it can be that under instructions, whether it be a personal care attendant or someone else within the facility, might have been given a direction to give a medication that they knew nothing about, and the ramifications of that drug they knew nothing about, and how they counteracted the administration of any effects of that drug. So it wasn't their fault, and it's not their fault, and it's not about patient care assistants versus nurses. This is about, again, the welfare and the caring of elderly residents. And of course, the Royal Commission showed that the medication errors can be quite devastating in some cases. They can shorten someone's life. They certainly diminish quality of life. And of course, they can shatter family trust in how their parent probably or grandparent has been treated within an aged care facility. Of course, the reform was demanded by the industry and by, as I said, families and unions. And of course, I want to give a shout out to the Australian Nursing and Midwifery Federation in their calls that ensure that not only nurses, with the training and the accountability and the professional expertise, and it does take professional expertise to administer medications in residential aged care. And of course, it takes many years of training for a nurse to become qualified to be able to administer these medications, as there does for other registered medical professionals. And one of those other registered groups that may happen into the future may be the paramedic practitioners that may be called to an aged care facility where they may have to administer some drugs. And of course, the professionalism of our registered medical professionals, such as nurses and paramedic practitioners, is second to none. And we want to keep that standard very high. Again, I referred to before that this bill delivers on the commitment made by our government at the 2022 state election to the Victorian branch of the ANMF to amend the Drugs, Poisons and Controlled Substances Act that only nurses administer medications in residential aged care facilities. Of course, we made that promise and we've stuck to that promise by introducing this bill, and it's very important because backing nurses means that we're backing safety. That's exactly what it's all about. And of course, backing the unions means backing the voice of those on the front line. And again, I can't thank the ANMF for their leadership and of course all of their members for the fantastic work that they do in making sure that people are safe and that their welfare is protected. And they do an amazing job in many, many different circumstances, under very trying conditions sometimes in aged care facilities, but they do a fantastic job. But in all health facilities, nurses do an amazing job. Of course, the providers, the Victorian residential aged care providers, will be required by law to ensure that only registered nurses, enrolled nurses or another authorised registered health practitioner administers high-risk medications. And again, I said before, this could mean that in the future paramedic practitioners may be one of those other authorised registered health professionals. We recognise that there will be circumstances where strict application of the rule could cause harm, for example, in rural settings where a delay, and people have spoken to this, a delay in access to a nurse could result in a resident missing urgent medication because they don't have someone that's qualified to administer that medication. And that's why this bill gives some level of regulation making powers to prescribe exemptions and safeguards, and it ensures that where flexibility is needed, it can be delivered. But of course, again, the core principle here is that for the majority of cases, only nurses will administer those types of medications that was referred to, or medicines that was referred to previously. This bill is not working in isolation. It complements many major reforms already underway at the Commonwealth level, including new staffing models, funding changes, and of course the introduction of a minimum care minutes, which require 44 minutes of direct care by a registered nurse per resident per day, which is really important. And 44 minutes doesn't sound like a lot, but when you have large aged care facilities, that's amazing work by our registered nurses. As I said before, they do a fantastic job, and we can't thank them enough. This bill is a really important bill for the welfare of our elderly citizens that are in these facilities. It's important that nurses deliver this care, and I thank them for what they do, and I thank the ANMF for their leadership in regard to this bill, and I commend the bill to the House.